So Emily, in your position, have you experienced any students who have been affected by general anxiety disorder?
Yeah. Oftentimes in my assistantship as a housing GA, we get students that come to us for a variety of different reasons. I think one of the biggest things that I've seen this year are students with social anxiety disorder, not necessarily knowing how to live with someone else. Also students with obsessive compulsive disorder and people who are living with someone different from themselves, or they might be feeling like the room isn't tidy enough. So it causes a roommate conflict and all sorts of tension, which then therefore increases different anxiety levels. Students who may be struggling academically might have test anxiety, so we get early alerts for those students, and being able to kind of talk with them and talk through those different things and being able to provide them with different resources is kind of where that comes into my GA a lot of the time.
Awesome. Thanks for sharing. Candace or Chanel, would y'all have anything to add? Fabulous. All right. So Candace, what are some ways do you think student affairs professionals in your position could help these students who suffer from general anxiety disorder?
I think by directing them to the right resources. There are a lot of resources available here on campus. So trying to find out what's the root of that problem. Why are they having general anxiety disorder, and how can I help them? So, is that me personally taking you to the counseling center, or is that, us going to the Office of Student Success, or we're sitting down with the advisor, trying to find a solution so that we can make sure that your time here is enjoyed and you don't suffer from this disorder.
Great. Thank you, Candace. Thank you. Chanel.
Yes.
So as a student affairs professional, what is a resource that you would recommend to a student?
Similar to what Candace said, we have the Counseling Center here on campus. That's a great resource for students to go and use to basically talk through their problems and the feelings that they're having and get some type of closure or advice on maybe how to deal with what they're going through. Not only that, but to further their experience, they offer disability services. So when you're suffering with GAD, you can also seek that help in class with your professor and get a little more assistance so you can focus and get the job done.
Awesome. Great. Question for you, Emily. Does generalized anxiety disorder affect just college students, or is it just like seniors, maybe freshmen, or how does that work?
No, I think generalized anxiety disorder is not limited to a certain age group. Even children experience generalized anxiety disorder. I think a lot of the times during college, students are really experiencing it just due to the different variables and things that they're going through, whether that's getting used to the classes if they're a first-generation college student, or even just a first-year student coming in and experiencing different class loads, different levels of stress in different areas of their lives, getting involved in things on campus and spreading themselves maybe a little too thin, or maybe people who just aren't used to taking on that type of responsibility, leaving home for the first time, living with someone different from themselves, students who lost my train of thought. But yeah, essentially just like students who are going through different things that they haven't experienced before in their life. So it doesn't necessarily just apply to a first-year student. It can happen to a student looking to get an on-campus job, thinking about different things that are going on at home, and then their anxiety levels can increase with that. Students who are looking to graduate, maybe 4 years or 5 years, and don't really know what that next step is for them. All these things and different variables in life can really add to or fuel generalized anxiety disorder.
Awesome. Well, thank you guys so much for participating.